In this video, we will discuss about hormones secreted by pituitary gland. As we all know that pituitary gland consists of two lobes. One is anterior lobe and another is posterior lobes. So hormones secreted by anterior pituitary lobe and posterior pituitary lobe are different. The hormones which are secreted from anterior pituitary are growth hormone, thyroid stimulating hormone, adrenocorticotropic hormone, gonadotrophic hormone, which include FSH, that is follicle stimulating hormone, and LH, luteinizing hormone. Next is prolactin, and MSH, that is melanocyte stimulating hormone. Only two hormones are secreted from posterior pituitary lobe. One is oxytocin and another is vasopressin, also known as antidiuretic hormone. So in this video we will discuss about only anterior pituitary hormones. The first hormone is growth hormone. Growth hormone is a peptide hormone and its secretion is regulated by hypothalamic hormone. From hypothalamus there will be release of growth hormone releasing hormone which will act on anterior pituitary and which form the release of growth hormone. And one hormone is that is inhibitory hormone somatostatin, that is also released from hypothalamus, which inhibit the release of growth hormone. So function of growth hormone is it has a growth promoting effect. It means it helps in growth of an individual. It also has an anabolic effect on muscles. It maintains positive nitrogen balance and promote utilization of fat. Clinical disorders which occur due to the either hypersecretion of growth hormone or due to deficiency of hormone. In hypersecretion, if hypersecretion occur in children, then it will cause gigantism, and in adult it causes acromegaly, and growth hormone deficiency leads to dwarfism. Where we can use next is growth hormone analogues. Only two growth hormone analogues are available. One is somatropin and somatram. These analogues are used when there is growth hormone deficiency. Stature can be almost normal if the early initiation of these growth hormone analogues are started. And another use is AIDS related wasting, as growth hormone has an anabolic effect on muscles. Next is growth inhibitors. The naturally occurring growth inhibitor is somatostatin. It is a peptide hormone secreted by pancreas, parts of CNS and hypothalamus. Somatostatin inhibits secretion of growth hormone, thyroid stimulating hormone, prolactin hormone, insulin and glucagon, and it is very short acting. So it's long acting. Another congeners were synthesized. One is octreotide and another is lanreotide. Octreotide is synthetic analog of somatostatin. It is more potent and longer acting. It can be administered subcutaneously and intravenously. Use of octreotide. It is used for treatment of acromegaly and symptomatic treatment of various hormone secreting tumor, that is carcinoid syndrome. Third is diarrhea associated with diabetes, and in some cases esophageal, for the treatment of esophageal varices. And lanreotide is a longer acting than octreotide. One growth hormone receptor antagonist is also available, that is pegvisomant. It is given subcutaneously and it is used for the treatment of acromegaly. Next hormone secreted from anterior pituitary is thyroid stimulating hormone. It is also known as thyrotropin. Thyroid stimulating hormone stimulates thyroid to synthesize and secrete thyroxine, that is T4, and triiodothyronine, that is T3 hormone. Action of thyroid stimulating hormone. It induces hyperplasia and hypertrophy of thyroid follicle. It also promotes trapping of iodide into thyroid by increasing sodium iodide symporter. It also enhances the proteolysis of thyroglobulin to release more of T3 and T4. And about T3 and T4 we will discuss separately when we will discuss about thyroid hormone and its inhibitor. Next hormone secreted from anterior pituitary is adrenocorticotropic hormone, that is ACTH. ACTH will stimulate adrenal cortex to secrete glucocorticoid, mineralocorticoids and androgen. ACTH is also used for the diagnosis of hypercorticism to distinguish between the Cushing disease and ectopic ACTH secretion. Next is prolactin. Prolactin is a peptide hormone secreted by anterior pituitary. It is also known as lactogenic hormone or mammotropin. It stimulates breast development and milk production. It is under inhibitory control of hypothalamus through prolactin release inhibitory hormone. There's, it causes hyperprolactinemia. The cause for hyperprolactinemia is either prolactin secreting tumor or pituitary adenoma or antidopaminergic drugs, which causes the hyperprolactinemia. It causes the galactorrhea, amenorrhea, infertility syndrome in female, and loss of libido and decreased fertility in males. So for their treatment, prolactin inhibitors are present. One is bromocriptine and cabergoline. Bromocriptine is an dopamine agonist. Its action is to decrease prolactin release. It also increases growth hormone, relieves symptom of Parkinsonism. It also stimulates CTZ, which causes nausea and vomiting. It is also a weak alpha blocker, so causes hypotension, and it decreases GIT motility. The use of prolactin inhibitors are in treatment of hyperprolactinemia, acromegaly, and Parkinsonism. The side effects caused by bromocriptine is early side effects are like nausea, vomiting, constipation, nasal blockage, and hypotension, and on later stages it causes behavior alteration, mental confusion, and hallucination and psychosis. Cabergoline is another prolactin inhibitor. It is more potent and longer acting than bromocriptine. Cabergoline is preferred drug for hyperprolactinemia. It is also useful in acromegaly.